This is News 3 at 11 with Jim Snyder and Jessica Moore.
Good evening. We begin with that historic day in Washington. Millions of Americans watched the big moment on TV as the Supreme Court upheld President Obama's controversial health care overhaul.
The way it went down surprised all the pundits and led to some confusion at first. In a surprise 5-4 ruling, the court decided the most controversial part of the law that requires Americans to buy insurance or pay a fee, which the court decided is really a tax, that is constitutional. Conservative Chief Justice John Roberts sided with the liberals and read the majority decision that allows the law to go forward. It requires all Americans to have health insurance in 2 years.
Justices Stephen Breyer, Ruth Bader Ginsburg, Elena Kagan, and Sonia Sotomayor joined Roberts in the majority, while Justices Samuel Alito, Anthony Kennedy, Antonin Scalia, and Clarence Thomas dissented.
So the big question tonight, will you feel the result of today's Supreme Court decision the next time you go to pay for health insurance?
News 3's Paul Matadine has been looking into that question for us. Paul, you spoke with a guy who sells health insurance, and he says the answer is yes.
Jessica, Jim, Larry Harrison told me today it's simple math for insurance companies. The most risky patients will ultimately pay less for insurance as a result of this act or be able to get insurance now for the first time. That's costly, and he says that we'll feel it.
When it comes down to it, the reason Larry Harrison says we'll likely pay more for health insurance given this law can be explained by this simple logic.
If a young person can buy a health insurance policy today for $100, which they can, and a sick older person buys a policy and their premium is $700, that's a 7-to-1 ratio. In the Patient Protection Affordable Care Act, it says the ratios cannot be more than 3-to-1.
And therein lies the cost. Harrison explaining what that ratio means.
That means the young, healthy people are going to be paying $200, and the maximum that the older person can pay is $600. So the young healthies will be subsidizing the sick old.
And for you, that likely means you'll have to pay more out of pocket to pick up for some people, paying less. Harrison says, however, that employers can help reduce costs by implementing wellness programs and offering more tailored options to employees. A qualified insurance broker, the key to making the right moves. We also met Brad Lee with the local business Lightspeed VT. He expects both his business and employees will soon have to pay up.
I mean, if the premiums went too much, absolutely they're going to be affected because I'm only paying so much.
Quite optimistically, though, he plans to use this challenge as a way to promote growth within his company. The rising costs, motivation for everyone to step things up.
If they increase by 30% and your profits increase by 50%, you're still up a net 20%.
And then he says everyone wins. Kind of a glass is half full point of view that we don't always see. That company, Lightspeed VT, specializes in online tutorials, among other things. So they're even thinking about approaching the state as a potential client who could use their service to inform people about health care. A very unique way of dealing with potentially higher expenses. Jim?